You're live.
Hey guys, it's Dr. Emer, and we're doing some more fillers today in the office, and it's exciting because it's not Friday, which is typically our filler Friday, but we're going to go live tonight doing a bunch of patient facial sculpting and training and teaching, so I can show all you guys some of the cool things that we do. But we have one of my long-term patients who's getting ready for a big event, and one of those things that I find most women tend to not like as they get a little bit older are fine lines around the mouth, and sometimes it makes a substantial difference using just a small amount of soft filler into those lines. So we're going to show you that right now. We have our pre-icing because that area is very painful when you do fillers. Let's lay on back, take the ice down. I'm going to show them the lines so you guys can see the little lines that are there. Some of this we're going to do little pinches, so I just kind of go right under the surface so you do a little bleb. And the goal is to do little baby blebs. This is a filler called Belotero. And when you do these small blebs like this, it integrates right into the skin and fills out those lines. It doesn't feel great, but she's a really good patient, unbelievable. And so we're gonna fill those out lightly, and I'll get the ice back to her in a sec. Just going along this upper border. The other thing we'll wanna do is just give a teeny bit of volume to the lip itself. And we did topical numbing, but the type of injection you wanna do here is little blebs.
They didn't do any numbing.
Did you do any numbing?
No.
Oh, did you not want numbing?
No, I wouldn't
Oh, they
take it.
should have done the numbing. I don't know why they didn't. Sorry,
I'd be
didn't you tell
really
me?
good,
All right,
right?
ice. No, you're amazing now. All right, ice
I'm
again.
really
Ice
amazing,
again.
right?
You can move.
I know.
Oh, I
Sweetheart,
thought
I
they
had 4
numbed you.
babies.
Well, she had 4 babies, and we have numbing inside the filler. So you actually now, this is what I typically is a good learning point. If that were to happen, there's numbing inside the filler. So now when I go back to the other side, you're really not going to feel it.
Okay.
So what I want you to do is on this side.
Oh, yeah,
though,
this side we're
yeah,
doing
we're
now.
going to switch over.
Oh,
So
yeah, let's do it a little
we
bit.
do a
right?
little dance. We go to one side to the other. Okay, lay on back a sec.
How long does this filler last?
So this filler will last her about 6 months to a year. She's done it before and it almost lasts her a year.
It's
It's
great.
Belotero, really smooth, really silky, really soft. This is our fine line filler. Go ahead and let go. Now there are some other brands that do have some other softer fillers, but traditionally in the U.S., this is the fine line filler.
I have a deep wrinkle on my forehead. Can we use filler for my
We
forehead?
can, and we can do Botox as well. So this is what I want you guys to see, that little milk mustache that's developing, that whitening effect. That's typically the Belotero integrating directly into the skin and a little bit of the numbing that's kicking in. So she's doing really well.
The cells in your skin begin to deteriorate as you age. Does this reverse the aging process?
Unfortunately, this doesn't do that. Now we're going to go back to the other side.
What, ice, which ice?
No, switch sides, yeah.
Okay.
So now, unfortunately, it doesn't reverse the aging process. This just plumps things up. If you want to build collagen, you need to do lasers and peels and microneedling and things like that to rebuild collagen and tighten the skin. Okay, let them go. Good. Okay, look up again. So now I'm going to do a little bit to the actual lip itself, a little pinch. So we can give her a little volume in the border, because that will then, again, make the wrinkles look a little better.
At what age should you start getting filler?
It's not really an age thing, sorry. It's not really an age thing, it's more of condition. So, for example, if we start a little earlier, we wouldn't notice as many lines or lost volume. Okay, ice again now on that side. Doing really good. I got you. Close. Land back a sec. Hold on close to the face. Lips hurt no matter what you do, especially if you don't have any numbing. Relax. Second. Good. So again, I'm gonna do that same thing in here. I wanna get the border of her lip and do just a little bit. So she has a little more lip show, and then we could also add a lip plump or two. That's just that would help. Now I'm gonna go back and do some of the fine lines again. We're just really rebuilding volume above the lip and in the lip itself using very superficial injections. It should be hurting less a little bit, I hope.
Palda says she's been waiting to get hers done.
Who?
Palda.
Oh, I would love for her to come.
Someone is asking again, how long does it last?
This will last about 6 months to a year, and I'm gonna have you ice again, ice your lip again. Almost done. I'm trying to really focus the one syringe for her so that I can get her the most value. Can you see it again?
Yeah, because I'm paying for that wedding.
I know, exactly. She's just paying for the wedding. Look up a second.
What would you use to treat lines on the neck?
We can use the same filler. We could do needles. We really need to see, because sometimes it's a combination of things. Now the last part is I do want to also improve a little bit on her lower. Sorry, honey. One. Especially if we make the upper so much nicer. One more. Okay, that's what I can do with the one syringe. Hold on. I want to show her. Open for me a second. Close. Good. Now let go. Great. Let me wipe her off. And that's really fine line filling and upper lip, sort of lip contouring for her. We'll work our way eventually with more filler around the mouth. But let me show her at least what that looks like. Take a look here. I want you to see.
Oh, yeah.
You see now what I did was all that whitening is where everything's going to fill in. So there's really not going to be lines there.
Okay.
And then I gave you a little bit of shaping to the lip itself because I want you to have some volume there. It gives support. So you have the border now, a little bit on the bottom top, and then the lines.
Perfect.
It should do great. All right, so she did wonderful. We will have her report in the next week or two, and that's it. That's fine line filling around the mouth. Bye, guys. All right, now ice your lips.